Hi, staff. Thank you for taking the time to meet with me today and listen in on the electronic health records that we'll be transitioning to. I think it's a amazing idea, having to have access for medical records for all patients online. I think that would benefit both patients and us. So I want to take a moment to fill you in on some information on and what we can expect as far as the electronic health records in each department. And if you have any questions, then you can go ahead and ask me. So we have purchased a new electronic health system. We are going to transition each department slowly. It will give better access, better care for patients. Patients' demographics and all that paperwork will no longer be needed, as patients will be able to have all that information and do it online. So that way, we have that follow patients. As long as also insurance, everything entails and doing prior authorizations will be easier access at the click of a button. The EMR, or the electrical health record system that we purchased, called MedLinks, has been around for years. They are one of the leading healthcare records out there. They are going to provide us with staff and on the job training throughout our transition. It seems a little scary. We're used to having a chart in front of us and writing everything and keeping everything on file. Pretty much that is what we're going to do, but we're now going to be able to have everything in the click of a button. Every physician that utilizes electrical health records will also have access to the patient information. Again, patient demographics, history, surgical history, medications, allergies, things that sometimes patients don't remember. They too will have access through this electrical health device or system online, which they can also have. They can go into what we call My Chart. Patients can write, to the doctor any concerns, questions, can be better, handled in that situation. So that way we're all on board with the patient care. I think it's a great tool. It's going to help us be better, have better information to give patient care. It is going to be this system that we purchased has different templates for each department. We're going to utilize it in the best way possible. I am looking forward to integrating. I think it's amazing. It would definitely give us better compliant with patients. Patients don't always remember their history. So once we get that put in, and other doctors as well as pharmacists, we all will know what medications they were started, why they were discontinued, and patients can also have that availability, wherever patients go, whether it's across the world or the other side of the world, these patient records will follow. If doctors are needing patients out of the country, they're able to get those records. Patients needs emergency surgery. Again, patient's not conscious, or whatever the case may be, these records will follow. So I think that's an amazing tool. It is something that I'm looking forward to and bringing into practice. They do offer, the ability to serve patients in different aspects, helping us also with billing. We'll have specific codes and ICD-10s for our diagnosis with a click of a button. It helps each department with time, filling out the paperwork, looking up certain diagnoses. We're going to have all of that available to us and to our practice being in cardiology. We'll also be able to schedule or have the orders available for patients with a click of a button. Any referrals that we need, prior authorizations, anything of that sort. We don't have to flip through any more pages or wait until we fax it or we get answers quicker. The documentation is available, so that definitely puts us in front of patient care. So I think it's very important that we just listen. We listen. They're going to have on staff available for us. If we do have any questions, 2 weeks out, we have training. So I'm looking definitely forward to integrating this. Other things that I want to attach is, sorry, I didn't know I was still recording. Other areas that we can look forward to is, besides patient information, demographics, insurances, we do referrals, prior authorizations for certain medications. We can now do everything online. So I think that's going to help a lot of the clinical nurses, so that way you don't have to spend all those times on the phone, trying to get this prior authorization. I know how frustrating it can be, and how long that process is. So we can, better utilize our time. I think that information, that goes from each department, since we do testing here, the sonogrammers, the sonographers, and everybody else in different departments are all going to be able to function as one. Again, we'll know exactly where patients are at any given time in our area. Also, once the doctor comes in and does his evaluation, they have certain templates and certain methods and questions that we're going to have them do for our doctors. So I think that's going to give us more time with patient, instead of having to flip through all the pages. Also, more time, we have more time to be with the patient when we can actually increase our patient volume. Right now we're limited. We're having to use medical records, pull the charts. I think that department will also be able to, kind of integrate with the system and have less paperwork. So I am really looking forward to it. I like the fact that, we have better patient care, better compliance, all of our prior authorizations as far as insurances and what is needed is going to be all in patient's chart. Again, one thing that I look forward to is having the history available, that is going to help nurses in, not ordering procedures that have already been done as far as labs, surgical procedures, scans, MRIs. They're all going to be on the patient's file. So there is no room, there's little less room for error when we do it this way. So that way we, as cardiology will be able to see what their endocrinologist or their consult went, or what tests were ordered. So that way there's no duplication of tests. So it's also going to give us some information, education. Once the patient is already being checked out and they're done with patient, they're done with testing, the doctors are going to have that test right there available, so they don't have to leave the room. They'll be able to assess the patient and give them the reports on the same day. So I think that's amazing. It cuts cost. It keeps them from having to come back repeatedly for results and testing again. I look forward to doing that with our clinic. They'll be able to come in, get their testing done same day, get the results. So that's going to save on the patient's deductible. One visit, get it all done. So that's something that we are going to do a little different, and I hope that you see, that this is going to be the thing. We want to be able to be on top of our game. We want to be able to also have that availability. And these electrical health records are pretty much every hospital clinic is utilizing a certain system, so that way we're all on the network. So I looking forward to working with MedLinks and see how our practice can better accommodate patients as well. So another feature that I want to talk to you about is education. Once patients are seen by the doctor is giving them, examining. If the doctor orders a certain lab, it'll ding them or it'll alert them that another doctor has ordered that same lab, so that way we can just request it. Any scheduling orders will automatically go with their hospital of choice. We'll actually have them input that information of what hospital they would want. They're coming in for surgical clearance. We're able to actually put in that information as well, so that way if they need any cardiac clearance or any clearance from our end, then that is also going to be available to the anesthesiologist and the surgeon. So again, that makes everybody be together, with patient care. We'll all know what the testing and what needs to be done or for further evaluation. Once doctors have seen the patient and they do a plan of treatment, by the time patient reaches the front office, everybody's going to know what he ordered, what he didn't, what medication changes there was, any recommendation as far as if patient has blood pressure issues or diabetes issues or anything of that sort with that history. He'll give, say, for diabetes, he wants him to have a sugar level of 100 or below. And that order is going to print out as the patient leaves, because a lot of times we know that patient compliance, they don't remember, they don't want to ask questions because they feel, they're asking a question that is probably dumb. They may think, I'm not going to ask that question, or I don't want them to think, I can't remember. Or if a family member is not with them, they want to know what the doctor ordered or what he said about diet, what about exercise, or if they talked about smoking, recreational drugs, what the recommendation was at the end of the visit. I think that's pretty amazing to have A lot of our patients are elderly, so they can't remember, if there was medications that were changed, or if they have to come back in a week, if they have to come back in a week fasting, or whatever the plan of treatment is. As the patient exited out, that all that information will be printed, whether doctor recommended a diet, increase exercise, or watch salt, whatever the instructions were, will be available for the patient. Once the patient closes a visit, they'll have that information available. For our copays, it has a calculator that will calculate depending on what their deductible is, if they met their deductible. We also have payment plans available for patients, giving them a 20% discount if they're cash pay. So this is going to, again, help us in time, so we can better spend with patient. And I think that's very important. Patients are the reason why we're here, why we have a job. And I think that being together and being able in as huge corporate hospital and part of the PO clinic, I think that this is going to be able to give us more time with patient, and that way patients know that we're on top of their medical needs and their necessities, and I think that's really important. And this is going to help us utilize all that and help in every department. So definitely looking forward to integrating this in our clinic. Again, we have researched several companies out there, and we purchased this ABC Medical for our ABC Medical Center, and I am looking forward to seeing what other changes or additions that we can add to help our patients. I think that community involvement is going to be more education, and offering all of this extra for our patients who have memory, or who are elderly or sick, or blind, or deaf, who have special needs or disabilities. They're also going to be able to have all of that information available to them. So regardless of where you're at, or what you need, or what you don't remember, it's going to be follow you wherever you go. I just think this is the new thing in healthcare. It's the future, and I'm looking forward to working with other clinics and hospitals that have talked about how it's changed their clinic. I know when we as we start anything new with anything, it's difficult at the beginning, but I think once we are challenged, to get all of the patient's information and medical records in the correct place, as we see fit, as doctors want their templates made. And each department has everything down, so I'm going to meet with managers from all the departments and units, and I want your input, what you think would be beneficial as far as what we need on the templates. Again, we will be having the company, what we call the code reds, on the floor to help us with this transition. So we do have the customer care. We also have pamphlets and booklets on educating us, and I am looking forward to utilizing this and giving that patient care better attention. I think that it's going to be, again, it's going to benefit both of us. I think that it's new. It's different, but it's definitely the in thing, and I look forward to transitioning our hospital. So if you have any questions, I will go ahead and meet with y'all, and we can go ahead and discuss this further. Thank you.